This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG Lafredo, and this week I am coming to you from the heart of the hospital, if you will. I'm at Kingman Cardiothoracic Surgery. My guest is Dr. Alon Asher. Hey, Dr. Asher, welcome back.
Hi. Nice to speak with you again.
It is my pleasure. I have to tell you, I'm going to suck up to you because you're the guest, but the truth is, I enjoy speaking to pretty much everybody I interview. But this is my favorite stop. Honestly, I have a couple of docs I really look forward to visiting with, and you are one of them. So,
thank you. It's a pleasure for me, for sure.
Thank you. I'll do my best to embarrass you a couple of more times along the way.
It helps me get my thoughts straight.
I want to talk to you about heart health. I want to talk to you about what you know, that esoteric. I get stuck. I get fixated on this stuff because, you know, you do open heart surgeries. You go in and you see the insides of us, and you have this privileged perspective that so very few of us have on health and on the human body. And man, it's just so interesting to me. I think I should have. Well, no, I don't. I'm not scientific enough. I couldn't have done it. But you've been doing this for a long time.
I guess so. Yeah. Now that I reflect on it. But, you know, what we see inside is not so different from person to person. And you know, before we just started, we were talking about, you know, can you tell, you know, the heart of a smoker?
Well, yeah, that's what I wanted to.
That kind of thing.
Yeah, let me ask that. You know, we make these health decisions and they affect us, and maybe we don't feel them on a daily basis, but over the course of years, absolutely, they affect our health. And I was wondering, when you go in there to do open heart surgery, for example, what do you see that, I mean, is there something, can you immediately identify and say, well, this is the heart of a smoker, for example?
Not always. I mean, you can tell because, you know, right around the heart of the lungs. And, you know, the lungs of a smoker are quite obvious, you know.
Yeah.
There's no question. And even a smoker that stopped smoking for a couple of years, the lungs do look more like a normal lung. So that's the first thing we see. Smoking affects mostly coronary artery disease. And between diabetes and smoking, there are some coronaries that you can tell. You know, these are the diabetic types, where there's diffuse disease. There are so many areas of blockages in calcium that it's hard to find a place to land a graft. But actually, what really, you know, differentiates a smoker is not even during the operation, but when you first meet people. I mean, you can tell when somebody's healthy and when somebody's not.
Right.
And when I assess a patient in the office or in the hospital, we're always trying to think, okay, what are the things, what are the pitfalls, where are we going to get in trouble? What are the risk factors that increase the risk of a procedure on a patient or a treatment? And which ones are reversible or not? There are some that you know, I mean, if somebody smokes and has blood sugars in the 300s, you know, you're not going to fix that right away, and the effects thereof are already there. But you can tell a healthy person from a non-healthy person. There are a few, you know, healthy smokers that walk around, but you can tell. I mean, you know, even if you didn't smell the tobacco, there's a healthy looking patient and a not healthy looking patient, and I think we can tell more from the outside than actually on the inside.
Is that right?
Yeah,
that's an answer that surprises me. Do you, for those people who have those problems like the higher blood sugar and the addictions, is their recovery time a lot longer after a surgery? Do you see much difference?
It can be, especially if they have, you know, more than one issue. Their recovery time may sometimes be, I mean, almost everybody's recovery time, except for really sick people who come in, you know, very sick in the hospital in an acute phase. Hospital time is pretty much the same, but they're more difficult to deal with. The tissues are more delicate. They're more little, you know, complications, things we have to do for them than we do with a healthy person. So it's more labor intensive, and sometimes you don't feel that you've done as complete an operation or as effective a procedure, because when we do an operation, let's say coronary bypass, our goal is not just to get out of the operating room and to have a quote unquote successful operation. Our goal is to sort of reset some of the process, and most importantly, and some of the patients just have a hard time with this, assure a long-term prognosis that's good with a quality of life that is sustainable and long. And obviously, those types of patients are more handicapped in that respect.
Bypass patients are not necessarily. Well, I mean, when you mention bypass, the first image that comes to mind is someone who's really out of shape and who's way overweight. But that's not fair, right? I mean, it's more complicated.
No, there are extremely healthy people who have just bad genes or just bad luck. We know many of the causes of coronary disease, the ones that everybody knows, but those are just statistics. There are people who smoke forever and never get sick. I remember the old commercial of when yogurt was starting to become popularized in the United States. It's some Greek guy who lives high in the mountains, who's been eating yogurt for 95 years, but you see him smoking a cigarette at the same time.
That's great.
It's more like what happens when you're driving on the road. If you don't stop at every stop sign, or if you go through a couple of red lights, you can get away with it for a while. And I'm sure that if somebody went through every stop sign every time, they can get away with it for a long time. But there's a higher chance that something will happen after some time. But can you get away with it? Yes. And I think it's the same thing in health. We do a bunch of things. We get away with it most of the time. But at some point in time, especially if there are more than one nefarious influence, it'll catch up with us. And recovery is not just physical recovery, it's psychological recovery.
Yeah.
You can have an extremely healthy person who, by bad genes, bad luck, or whatever, needs to have a coronary bypass operation. We find great spots to put our bypasses. The circulation is normal, the heart hasn't been damaged, but the psychological effect can be dramatic. Here you have somebody who thought they were always healthy. I did everything. I didn't smoke. I exercise every day. I eat right, etc. Then I'm here, and they're questioning, their existence, their reality. How come I got this? My standard answer is, you would have gotten this much sooner. You've been able to preserve yourself until now because of, the healthy way you've been living, and your outcome is going to be better because of that. It's hard to imagine because people see it as a punishment.
Yeah, right.
I got my disease to punish me for the things I've done before.
All the
and
sinning.
This is something that'll happen.
Yeah.
And if you take 1,000 healthy people, a certain percentage of them will have these things, no matter what.
Is this a kind of counseling aspect? Is it a significant part of your time with patients?
Very, very significant.
Yeah.
There are patients that will sail through anything like nothing. And in general, it's an unexpected type. We know the most difficult patients to deal with, who see their whole life in question. Why did this happen to me, or am I prolonging my life, or I could have died, and that sort of thing, are the least likely logically. A young, healthy person usually takes it pretty badly psychologically. Are the most difficult patients to deal with on that. Almost everybody that goes through a heart operation has a period of depression. It could be just a few days. Usually happens about the fifth day post-op. It can last for weeks. It can last for a few days, and it's an extremely important aspect of what we do, because it affects everything. It affects their motivation to do exercise. It affects their reliability with medications. in general, the best way to combat that is getting back to normal life as soon as possible, not making a drastic change in a less active way. Getting back to your own schedule, regular clothes, your regular bed, getting outside, and not. The worst thing is to wear pajamas, rent a hospital bed, and stay home, and that increases the depression. Family support is extremely important, and trying to make people understand that A, it's not their fault that this happened. B, all the things that they've been doing that are good are actually going to help them. So the typical persona is a young, healthy male. That's our worst patient to deal with. They experience pain much more. They get depressed more. They are sometimes the hardest to motivate. An older, thin lady in her 80s will sail through any kind of cardiac operation without any consequences. Yeah. It's so easy. I mean, I see people and say, okay, we're going to have a hard time with this one. Yeah. And it's a complex thing, I'm sure, but partially it's the realization that, you're no longer invulnerable. And that plays a gigantic role. People who don't care about their health sometimes do better than people who do care about their health.
It's crazy, right? It's unfair in the cosmic scheme of things.
It is unfair.
It's break time on Focus on Your Health. We'll be back in a moment for more with Dr. Alon Asher. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. The Cath Lab at KRMC combines medical excellence and cutting-edge technology. Catheterization allows doctors to diagnose and treat a variety of heart problems. You can learn more about our program at azkrmc.com. KRMC. And welcome back to Focus on Your Health. I'm TG Lafredo, and this week my guest is Dr. Alon Asher. He is the director of KRMC's Cardiothoracic Surgery Program.
When you think about your entire patient base, in terms of demographics, how many of them are those younger guys? Are you mostly operating on older people?
Mostly, yeah. It has to do with the area we're in, and with the type of disease. We're in a older age population. A lot of retirees come here, so you'll get older people's disease. Coronary disease is one. Aortic valve stenosis is another one. The aortic valve wears out after time, and as people get into their later years, that valve gets calcified, and I've done a lot more aortic valves here than I've done, for example, in New York, in terms of proportions, because of the type of population. We do have an enormous amount of smokers here, and it's a bad type of a smoker because it's hard to get them to stop. Not only a week before an operation. My standard East Coast large city type attitude is, listen, you're smoking. Stop for 10 days, we'll do your operation, don't start again. And with appropriate counseling and horrible looking pictures and good data, 95% of patients just stop smoking and don't stop. In an environment like this, the ratio is reversed. You know, everybody will come back and say, listen, I did have a few cigarettes. So the prevalence of that does condition two things, the recovery of the patient, because lungs, I've had more patients here go home on oxygen than in my entire career. They don't go on oxygen, permanently, but their lungs are affected by the whole process of the surgery, and they do require oxygen for a certain period of time. Sometimes just a few weeks, sometimes just a couple of weeks, until the lungs heal. And we didn't do anything to the lungs really, except insult them through the operation and the trauma of the surgery. But these are lungs that are already, starting with a low proportion of their full capacity. We do lung function testing on everybody essentially, except for maybe non-smokers or people at very low risk. And it's rare to get a normal lung function on a patient here. It's more usual to get something about 50% of their ideal capacity. That's the common thing.
But that affects everything in their whole lives, right?
It affects everything in their lives. It affects their exercise capacity. It affects their attitude towards their health, and it affects the type of disease they have. They have more diffuse disease, more blockages, more areas that are blocked, needing more bypass for a coronary artery operation. So we get, in terms of the population here, we get the smokers and the older people. And it is a different population that you'll see in different places, for sure.
I want to ask you about we talked about this before too, but it's one of those, I think it's important to talk about, your portrait of heart health. We all need specific health advice, but then there's some of it that just applies to all of us. What should people know about taking care of their hearts?
There's a very easy answer and a difficult answer. And I'll give you the easy answer because we know a lot more now than we used to know before. The American Heart Association had this sort of cardiac diet that we should follow. The classic, low fat diet, avoid full fat food, avoid red meat, avoid take the lowest percentage fat milk that you can, et cetera, no eggs, that kind of thing. That's out the window. Nutritional research has shown that if anything, it's probably worse than eating almost everything within reason. The successful diets, the successful healthy diets, are diets where that affect the person on multiple levels. The nutrients they get, so nutrients themselves should be as fresh, as whole as possible, less processed. That has been shown time and time again to make a gigantic difference. To eat live things, things that grow, and the psychological effect, which is I can't have this. Some people react totally opposite. I can't have this, so I'm going to have another slice of pizza. I'm going to have a whole pizza, and that sort of thing. And some people, but pizza's not unhealthy. If you have a slice of pizza, every couple of days, it's not a bad thing. We've induced guilt in people. So that guilt, that anxiety that people sometimes experience as they're about to decide what to eat or about to eat something they decided to eat, but they think is bad for them, is a terrible, terrible thing. The healthiest countries in terms of cardiovascular disease, and we're talking about atherosclerotic vascular disease, coronary disease, blockages due to lipid deposits and calcium deposits that block your arteries, are countries that eat almost everything. The portions are smaller, so you can't get fat, but the restrictions are less. So the Mediterranean diet entails, fruit, nuts, vegetables. Red meat is fine in reasonable quantities. the chicken without the fat thing is not true, and the recommendations for a heart healthy diet have changed unofficially. Will change officially very soon to allow a liberalization of these things. So it's minding your quantities, having a varied diet, and staying away from processed foods. Anything that has multiple ingredients that you can't read is probably something bad. And there seems to be a tendency, and I'm very optimistic about that, in our country towards not so much natural, not so much organic, because the labeling has gotten in the way of the reality. But people cooking, people going to buy fresh vegetables, fresh fruit, and making something. That's a great experience. I think it's a good psychological experience, and it's also a healthy thing. So, what makes a heart healthy lifestyle? Obviously, the diet is important. Satisfaction with what one does. The psychological pressure of being unhappy is a well-known factor influencing cardiac disease. Exercise is extremely important, but exercise is not, running 5 miles a day. Is doing, for most people, a half hour, 5 times a week, walking a mile, but not a mile in 10 minutes, a mile in 20 minutes. A continuous low to moderate level exercise is best for heart health. What I wanted to say about diets is the same thing I'll say about exercises. The pressure should come off. One should pick something that's reasonable, repetitive, or repeatable, and that can be sustained over a long period of time, something that one can be consistent with. So it can't be something that's so difficult to do that you can't do it every day. You'll do much better doing something reasonable consistently than trying to cut down on certain foods, for a few days, or do an enormous amount of exercise, but for a limited period of time. Continuous and consistency is extremely important.
That's Dr. Alon Asher. He is the director of cardiothoracic surgery at KRMC, and he is still one of my favorite interviews.
Okay.
Dr. Asher, thank you so much.
It's my pleasure. Looking forward to the next one.
And that's the show. That is Focus on Your Health. I'm T.G. Lafredo. Thanks for listening. And before we go, a quick reminder that this episode and about 100 others are available right now on demand on YouTube. You can go to YouTube, search for Focus on Your Health, and you'll be able to stream all kinds of different radio adventures that we've had together over the last, almost 4 years now. It's always a lot of fun for me, and I hope you're enjoying it as well. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next time.
This is Focus on Your Health. It's brought to you by King... You just got yourself an outtake.